Sharp pain when breathing in. Main causes. Sharp pain when breathing in can occur for several reasons. The symptom can range in severity, with some people noticing mild discomfort and others experiencing severe pain. In most cases, pain around the chest and ribs is not a sign of serious illness, and it will resolve on its own or with minimal treatment. However, it can occasionally be an emergency, requiring urgent medical intervention. In this video, we discuss 7 possible causes of sharp pain when breathing in and explain when to seek medical attention. Pneumonia. Pneumonia is an infection of the lungs that causes inflammation of the air sacs, which fill up with fluid or pus. Pneumonia occurs as a result of bacterial, viral, or fungal infection. The severity of the condition depends on a person's age and overall health. People with pneumonia often experience chest pain when breathing in. The other symptoms, which may range from mild to severe, include a cough, coughing up sputum, a green or rusty phlegm from the lungs, high fever, chills, difficulty breathing, fatigue, sweating, fast heartbeat. Both the type of pneumonia and the severity of the condition will determine the treatment options. For bacterial pneumonia, which is most common form, antibiotics may help treat the symptoms. Antiviral medications, rest, and a high intake of fluids may help treat pneumonia resulting from a virus. Antifungal medications may help treat fungal types of pneumonia. A doctor may also recommend over-the-counter medications to reduce the symptoms of pneumonia. Pneumothorax. Pneumothorax, also known as collapsed lung, occur when air enters the pleural cavity, which is a space between the lungs and chest wall. The air accumulation can increase pressure in the pleural cavity, making part of a lung or even an entire lung collapse. Pneumothorax can occur as a result of a chest injury or an underlying lung disease such as tuberculosis. People with pneumothorax may experience sharp pain in the chest that worsens during breathing or coughing. The degree of collapse determines the signs and symptoms of pneumothorax. This may include shortness of breath, sudden chest pain, tightness in the chest, heart palpitations, fatigue. Cyanosis, which is where the skin or lips turn slightly blue. Treatment for pneumothorax involves inserting a chest tube or needle to remove excess air from the pleural cavity. For mild cases, the condition may heal without this procedure being necessary. Pleurisy. Pleurisy is an inflammation of the pleura, a tissue that lines the chest cavity and covers the outside surface of the lungs. Pleurisy often results from viral or bacterial infection, with viral pleurisy being among the most common causes. People with pleurisy tend to experience sharp pain, particularly in the chest, when inhaling. Symptoms of pleurisy include sharp pain in the chest that worsens during breathing, pain that radiates to the shoulders and back, shortness of breath, coughing. The treatment for pleurisy will depend on the cause of the underlying condition. For instance, if the condition is due to a bacterial infection, a doctor will prescribe antibiotics to manage the symptoms. For the pain and inflammation that pleurisy causes, a doctor will recommend non-steroidal anti-inflammatory drugs such as ibuprofen. Costochondritis. Costochondritis is an inflammation of the cartilage, a tissue that connects the breastbone and ribs. The chest pain that costochondritis causes can range from mild to severe. People with costochondritis often experience chest pain, which may radiate to the back. The exact cause of costochondritis is unclear. However, the condition may result from a chest injury, strenuous exercise, severe coughing, or a joint infection. Costochondritis typically heals on its own. However, a doctor may prescribe non-steroidal anti-inflammatory drugs to relieve pain. Physical therapy, including stretching exercises and nerve stimulation, may also be helpful, as may heat treatment. If other measures do not work, a doctor might recommend injecting corticosteroids or numbing medication directly into the affected area. Chest trauma. A traumatic injury to the chest may result from a sports-related incident, a surgical procedure, or an accident such as a fall from a height. Approximately two-thirds of people who experience physical trauma have chest trauma, with this severity ranging from a rib fracture to injury of the heart. Chest trauma can lead to sharp pain when breathing in. Other symptoms of chest trauma may include shortness of breath, pain that radiates to the neck or back, coughing up blood, bruising of the chest wall. Doctors will determine the best treatment for chest trauma based on the cause and severity. For instance, if a person is gasping for air, cardiopulmonary resuscitation or CPR will likely be the first approach. People with chest trauma should seek immediate medical attention. Anxiety attack or stress. Severe stress and anxiety may cause anxiety attacks, a possible symptom of which is sharp pain when breathing in. An anxiety attack can produce a stabbing, needle-like sensation in the middle of the chest, the dread of an upcoming event, or a fear that something could happen typically triggers the condition. People may experience the following symptoms during an anxiety attack: chest pain, heart palpitations, difficulty breathing, lightheadedness, sweating, a headache. Treatment options for anxiety-related disorders include cognitive behavioral therapy or CBT, support groups for people with specific conditions, prescription antidepressants or anxiolytics to reduce the symptoms. In some cases, anyone considering seeking professional help should ensure that they select a well-trained and qualified professional. Pericarditis. Pericarditis is an inflammation of the pericardium, the sac-like tissue surrounding the heart. The cause of pericarditis remains unclear, but viral infections are a common cause. Other factors may also cause pericarditis, including injury to the heart or surgery, inflammatory disorders such as rheumatoid arthritis or lupus, other health conditions including tuberculosis or kidney failure. People with pericarditis experience sharp pain when breathing in, or a dull ache that may feel better when sitting upright or leaning forward. The pain may also radiate to the left shoulder and neck. Other symptoms of pericarditis can include fever, shortness of breath, lightheadedness, heart palpitations, swelling of the abdomen and legs, a cough. The best treatment for pericarditis depends on the cause and severity of the condition. If the condition is mild, it usually gets better on its own, For more severe cases, a doctor may prescribe over-the-counter pain relievers and corticosteroids to reduce inflammation. When to contact a doctor? Sharp pain when breathing in can sometimes be a sign of a life-threatening condition, such as a heart attack. A person should speak with a doctor about any unexplained sharp pain when breathing in, particularly if it occurs alongside the following symptoms: difficulty breathing, chest tightness or pain, severe shortness of breath, rapid breathing, air hunger, which refers to the inability to breathe in sufficient air, sudden dizziness, fever, excessive sweating.